Welcome, everyone. We'll get started in 1 minute. Welcome, welcome. As we gather, feel free to enter your name and organization and location into the text chat if you want, and we will get started. Thank you for joining today. This is our agenda. My name is Amy Auchincloss. I'm the lead epidemiologist and supervisor for the Big Cities Health Coalition data platform. And I'll provide a brief orientation to the platform, and then we'll hear from our fabulous speakers on how local health departments are using the data. We're showing a poll on the screen. So if you can take a moment to answer those questions, we would really appreciate it. I'm here today with my fabulous colleague, Saima Niamatula, who's a very talented data manager and is the lead data analyst and responsible for data management for the website. We are both from the Urban Health Collaborative, which is at the Drexel University School of Public Health in Philadelphia. And the Urban Health Collaborative supports a number of urban health projects across the nation and around the globe. We have been working with BCHI on their platform since around 2020, and we're thrilled to continue to partner with them on this important resource. On the left here are the BCHI team members that have helped us so much with the platform, so big thank you to them. Thank you to the CDC, who is the primary supporter of the platform. The views expressed here do not necessarily reflect the views of the CDC, nor BCHC's foundation funders. A big thank you to the 35 BCHC members who have supported the data platform over the years. And these are the cities that are on the data platform, and many of them are on today's call. So thank you very much for joining. If you have questions, anyone has questions, please put them into the Q&A box, and we'll make sure they get answered toward the end. So what's on the platform? We currently have over 125 metrics that are grouped into these 11 categories shown on the right, covering about over 200,000 data points, and it's annual data from 2010 through 2023 for the when the metrics are available. The platform differs from other platforms in important ways. The majority of the data are city level. They're newer data than many platforms have. There are a larger number of metrics than many platforms have, often 3 times as many metrics. And many metrics have data for racial and ethnic subgroups, and we can look at trends over time. So there's a bunch of ways to capture the data from the platform, and I want to show you on the website. This is our homepage. I've pre-populated some charts in the Compare Cities tab with North Carolina and 4 cities plus the US total that can be selected from the drop-down with death from all causes and poor air quality. So death from all causes, we can just hover over the points to capture the values that way. We can also, for any of these points, we can also click on this hamburger up at the top of the chart, download images from this specific chart, as well as download data. So the download data you'll find has a little bit more detail than is displayed on the chart. In some cases, we have confidence intervals for the values, and those are not displayed on the chart. Another way to capture the data is to go up to the top, the share button. This will regenerate the exact same page that you have created here. And you can share that on social media or just directly to your colleagues so they can visualize what you want them to visualize from this whole page. You can scroll down to the bottom and click on the download button. That will allow you to download large pieces of the platform data, many metrics, many years, many cities. The technical documentation is there, the code book is there, and there's a place for questions. Finally, I want to draw your attention to the What's New tab. This is where you can get data summaries. We have some data summaries posted for lead poisoning, overdose deaths, our climate metrics that are on the platform. And all the way up at the top, again, the FAQ page is an important page where you can find technical documentation and get answers to many of the questions that you may have. And if you forget where to download the data, there's also a tab there around downloading the data. So let's go back to the slides will be available just as a refresher after the presentations. So let's move on to our expert local health department folks. Thank you so much for spending the time sharing your expertise and how you're using the data. Let's start with Megan Todd from Philadelphia Health Department.
All right. Hi, y'all. So I am Megan Todd. I am now sharing my screen, I think. Yeah.
Perfect.
Okay, thanks. So I'm the chief epidemiologist here in Philadelphia. And I'm excited to show you how I use the Big Cities data platform. It's something I come back to again and again, probably every week I'm here. And what I use it for most is to understand how Philadelphia fits into the context of what's happening in other big cities and across the country. So I was going to walk you through an example of how I use the website and talk through, so for example, drug overdose deaths, which is something that I'm sure we all are thinking a lot about these days. So often, the first thing I'll hear about when we have new data in Philadelphia is, a count. So for example, we hear from our medical examiner, there were 1,300 deaths from overdoses in 2023. And so to give that meaning and to put it in context, thinking for the media, for folks making decisions, for the public, we need to be able to answer my favorite question of all time, which is that a big number or a small number? And in order to answer that, we really need to be able to compare it to something sensible. So we have a good handle on data from Philadelphia, but we can't really say, oh, is there something special going on in Philadelphia, or is this something that's happening everywhere? And so that's where the platform comes in. So I love the Compare Cities tab. I'm just going to show you an example of how I use it. So we're just going to scroll down. Our primary city is Philadelphia.
Megan, you may not be sharing the tab. So we see the What's New page on your screen.
Let's see, let me try that again. How do I know?
Perfect.
Okay. All right. So from home, I'll go to this tab, the Compare Cities tab. I'll pick my primary city, Philadelphia. And then I can pick different comparisons. So you can look at the US total, specific cities, or often I'll just look at all the cities included. And you come down here and pick a metric, and you can see there's tons of things in here, which is one of the things that makes this a really useful platform. So you have to scroll for a little while until you get down to drug overdose deaths. And then you'll see you get this handy bar chart. And so right now it's sorted in alphabetical order, not always useful, depending on what you're trying to do, but I usually like to sort it high to low. And then it just makes it really clear to see how Philadelphia stacks up against these other big cities in terms of overdose deaths. And these are age adjusted per population. And it also has this handy reference of the US total here. I often like to use this group cities option and look by population. So this just kind of helps you look at the biggest cities up top compared to everyone else. Again, just makes it really easy to see how Philadelphia compares to peers. And speaking of peers, there might be specific cities that you think are most similar to yours. And so one thing I really like is this 5 comparison cities option. And so it automatically picks some comparison cities for Philadelphia. And so these are cities that are similar in terms of region and population makeup, and the kind of cities that we often think of as our peers. So I'm going to ungroup here. And then it just makes it really easy to see, compared to these cities that we often compare ourselves with, how are we doing? So this is giving us a point in time in 2023. Often we're more interested in looking at trends over time to see how those are moving along. So you can go over to this year option and click all years, and then get this really handy chart. So you can really see the trends and highlight each city differently. All right, I'm gonna show you one more thing, which is the ability to group these line charts by race, sex, or race and sex. And I'm going to show you something that we've kind of seen, which I think other cities probably have seen recently. So we're looking at drug overdose deaths by race and sex. And so we really saw a peak in 2017 among white men and a decline. But among Black men, we've continued to see this increase. And I think this is a narrative that the media has picked up pretty well. I feel like we're hearing this story a lot. But one thing that I think we've heard less of is what's happening with Hispanic men, where we're similarly seeing this increase. And it's almost as high, the level here is almost as high as it is among Black men for Philadelphia. So again, I want to be able to say, is this something special that's happening in Philadelphia, or are all the cities experiencing this? So I'm going to go back up here again and add my comparison cities. And then I can look among Hispanic men and see that Philadelphia really has had this continuous rise that looks a little different from other cities. Baltimore seems to have also had an increase, but it's been a little more sudden recently. And some of these other cities haven't really had that same increase. And similarly, we're seeing this increase pretty much in all cities among Black men. So kind of looking at these things kind of helps us think about what's happening in Philadelphia. Is it a Philadelphia specific thing? Who else should we be talking to when we're thinking about ways to do this? When we're thinking about outreach, it makes a big difference if we're talking about outreach to Black men in the city versus Hispanic men in Black City, for example. So a couple of plugs for the platform. There's tons of info from lots of different data sources, and it's all in one place. So you can look at Burfus, at Urbis, at Vital Statistics, at ACS, and there's kind of all right here, very easy to find. Another thing that I really love is the documentation is excellent. So here's an example of the documentation looking at lead poisoning. And there's just a really clear explanation of what the cutoff is for it to be considered high blood lead levels, or whatever it is. And so this notation that we're using, the cutoff of 5 micrograms of lead per deciliter, even though that has been a different, let's see, where does it say this? Yeah, so CDC has changed some of the reference level to now be thinking about 3.5. And the documentation kind of really explains why we're using 5 instead of 3.5, and also talks about some of the concerns that cities have with looking at with the specific lab assays looking at 3.5 versus 5. So just kind of this really useful information about why we have those reference values, and how they might be different across cities. And then the last thing I'll say is just put in a plug for the big cities team and for the Drexel team. They are amazing. They are very responsive to questions and very helpful. And they really want this data to be useful and want folks to use the data. So, I've talked with Amy about things that I kind of wanted to see slightly differently or to see change, and very responsive. We've been able to make those changes and see those to make the data more useful. So that's it. I'll pass it on.
Amy, you're on mute.
Sorry. Thank you so much, Megan, for all of your use of the platform and feedback and helpful comments. So it's really, please forward comments that you have when you're looking at the platform to everyone, for all of us, so that we can try to reply and respond. So let's move on to Shiraya Thompson at Long Beach, and please step forward.
Thank you, Amy. Let me share my screen. Okay, looking good.
Perfect.
Wonderful. Hi, everyone. My name is Shiraya Thompson. I'm a data analyst with the Long Beach Department of Health and Human Services. And I'm going to be sharing a little bit about how Long Beach is using data from the BCHI platform, primarily to power our racial and health equity data hub. And so I'm going to show you all a little bit of what that looks like. But first, to provide an overview, the Data Hub provides interactive tools for health department staff and community members to explore how social determinants of health impact various populations in Long Beach. So it's public facing. We want the community to use it as well as our staff. The website centralizes health related data on chronic diseases, communicable diseases, maternal and child health, public safety, economic equity, and housing, all for the city of Long Beach specifically. And it's intended to support our work as a health department, as well as the work of our community partners, and kind of keep everybody on the same page and informed about the status of health in the city of Long Beach. And so the data that we get from Big Cities Health Inventory platform allows us to kind of anchor all of this city level information that we're providing with insightful population-based data on a timely basis. Okay, so why did we select BCHI data to power this data hub? So our department recognized a need to identify disparities in order to be able to effectively design equitable intervention. So it was really important to us to have data that was disaggregated by race and ethnicity, specifically at the city level. So oftentimes we're able to easily find county level, state level, national level data that's disaggregated at this level, but it's a little more difficult, at least in my experience, to find this data disaggregated at the city level because we are a city health jurisdiction. Another reason we really like using the BCHI data is that there are so many indicators, and we are able to find a decent number of indicators for each of our for each health area that's aligned with our community health improvement plan priorities. So these are like chronic disease, communicable disease, maternal and child health, mental health, neighborhood safety. And then also lastly, and this is not an exhaustive list of why we use BCHI data, but one of the main reasons we use it is our leadership wanted a dashboard that could regularly be referenced as different projects and initiatives are being planned and pursued. And so we wanted data that we could get reliably on a consistent and not too long of a turnaround. We do have an internal epidemiology team who works with many of the data sources, namely the vital statistics um, records system. But and other jurisdictions may experience the same, where your epi teams may have downsized in the past couple of years and may not necessarily, have the capacity to, produce and analyze this data on a quick and regular turnaround. Okay, so the BCHI data has been really helpful to have just ready to go. Okay, so now with that, I'm going to show everyone how we incorporated this data into our Racial and Health Equity Data Hub. So is that screen showing as well? Okay, good. So this is our landing page. So like I said earlier, we're depicting data that aligns within our key health areas that were identified in our Community Health Improvement Plan, and these are all of them here. So I'm gonna click into our chronic diseases section. And we see here that the chart looks very similar to how the data is depicted in the BCHI platform. One thing we added was that's maybe different from how the data is depicted in the BCHI platform is the ability to toggle by filter by sex, and that's an option because when we download the data, that's included in the data set that we get from BCHI. So that's really cool. So you see we embedded these charts within a larger website, and we added some text summaries to describe what we're seeing in the charts. Sometimes we depict them as time series. Sometimes we just take out the most recent year and provide bar charts for people to compare across race and sex. Yeah, and then there's a whole bunch of other aspects of this hub that maybe are not within the scope of the current webinar, but that just to give you guys an idea of how we're taking the data and kind of making it specifically tailored to what people are interested in Long Beach. So yeah, in terms of how we went about doing this, what tools we use Tableau to create custom visualization. So the data charts I just showed they're aligned with our city's branding guidelines. And it was a fairly straightforward process. So we downloaded the CSV file from BCHI, added the file as a data source in Tableau, and then created a worksheet for each indicator of interest. So I just showed you all cancer deaths, heart disease deaths. We created a worksheet for each of those indicators. And in terms of the level of work capacity that was needed to kind of carry that out, originally I was a team of one building things out, and I had not had any Tableau experience. So that influenced the timeline a bit. It took me about, I would say, 2 to 3 months to set up all the worksheets, and also while doing some Tableau trainings as I went, as well as, balancing other tasks. So that itself, I didn't find too difficult. I think if your jurisdiction is using Power BI and would like to do something similar, that would also be a fairly similar process. I think building out the actual website into which these charts are embedded took a little bit longer, and that's a bit, I think, beyond the scope of the webinar. But if you're interested in doing something similar where you're building out an entire website, I'm happy to connect outside of this meeting. But yeah, in terms of updating the tool with new data releases on an annual basis, now that everything's set up, the refresh only takes about 5 minutes to complete. It's as simple as downloading a new CSV file from BCHI, adding the file as a data source in Tableau, so following those original steps, and then just switching the new data set out with the old data set. Okay, and so in terms of how people in Long Beach are actually using this data and getting value from it, like you saw, the visuals are embedded in our data hub. So community members are using it, staff is using it. We're currently collecting data to learn exactly how people are using it. But concretely, some examples of how our department is using it has been pulling some of the visuals to include within our community health assessment report. So we can export the visuals as image files and plug them right into our PDF and print reports. We also are doing an annual update on the state of public health in Long Beach. And similarly, the visuals are being pulled straight from those Tableau worksheets. And then lastly, our department is partnering with community partners to conduct sub-community needs assessments. And those assessment teams are referencing this data in their literature reviews to situate the project findings within larger population level context. So it was cool to recently I was reviewing one of the drafts of the reports and saw the big city health inventory being cited. Okay, so that's pretty much a quick summary of how Long Beach is using the data. If anyone's interested in connecting, this is my email address here, and I think it'll also be shared by the team.
Thank you so much. That was wonderful. Thanks so much. We're already getting some thank yous in the chat to you. So there may be some questions coming up at the end after we cover the rest of the presentation. So thanks so much. Next up is Elizabeth Green, who also has an example of the using the platform data to power some widget on the BCHC website.
Yeah, thank you so much, Amy. So similarly to Shiraya, I'm Elizabeth Green. I'm the comms director for Big Cities Health Coalition. And as Amy mentioned at the beginning, we partner with Drexel University to provide this resource to the community. And so what I want to talk about is how we have used an API interface. I noticed a few of you have asked questions about this. Used an API to connect our site to the Big Cities Health Data site in order to make it easier for people to start a search on our own website. And to give a little bit of context here, why is this on a separate microsite? It's basically just an issue of making it easier to maintain that platform. It's on a separate site in order to kind of allow a certain kind of infrastructure to be in place there that would be hard to shoehorn into our site or Drexel's. So it's been a little bit of an ongoing challenge to point people to bigcitieshealthdata.org from our own site as seamlessly as possible. And I just want to show you, just to give you a sense of what it used to look like. This is from the Wayback Machine, if you've ever used that, which shows you kind of historically what the web used to look like. This is our site from a couple of years ago, and the way you would get to the dashboard was through this little tiny link, which was not ideal. So I started working with our web developer and with Amy and her team to figure out a way to make it more make a more seamless interface between our site and theirs, and make it kind of bring some of the functionality of this data platform into our own site. So our city data page now looks like this. I'm clicking on the city data page up here at the top. So now right here at the top, you have a few simpler search windows. They're less complicated than what appears on the Big Cities Health Data site, because I didn't want to overwhelm people right away, but it gives you that same option of starting from a city, starting from a metric, or specifically exploring inequities, which is another segment of the site that we haven't talked about quite as much in this presentation, but you can start here, choose a city, and then it will prompt you to choose a metric. And just by the way, you can always just type things in if you want to kind of narrow it down and not have to scroll through. So you choose your metric, and then when you click View City Data, it will open up a new window, take you into the bigcitieshealthdata.org site, and pre-populate everything that I just chose on the previous page. So you're kind of already in that mode. I've got Charlotte, I've got breast cancer deaths, and then I can refine it from here. I can do all of the stuff that Megan was showing you, where I can, kind of choose a year or choose something to compare it to, choose comparison cities, and so on. So that's really the main thing that I wanted to show you, is that it is possible. Our web developer took about 15 hours to develop this with Drexel's developer team. And I think it would be very possible, if you kind of think about what your web developer's hourly rate is or what it would cost. I think it's perfectly reasonable to set up something like this on your own site if you think it would be useful to kind of give people the ability to explore some of this data from your own site. And with that, I will turn it back over to Amy.
Thanks so much. Yeah, this is another option. I know some of you have some restrictions as to what you can put on your website, but there may be some link outs that would populate directly for your city to a chart that we have that you've already populated with something that you want to show your viewers on your website. So there's that type of functionality could be so simple. It's just a link to a chart. Or it could be a little bit more involved with pull downs using a widget like Elizabeth was sharing. So our next speaker, thank you for all your time, Katherine Hathaway from San Antonio.
Hi. I think Elizabeth, are you going to share my slides for me? I'm Katherine Hathaway, epidemiologic method specialist and statistician from our Epidemiologics and Informatics division in San Antonio. And my title is, I want to talk about the forest and the trees, because I think when you think about this platform, the Big Cities Health Coalition data platform, it's a lot of sort of comparing our localized data nationwide or between states. But I found recently that I can also use it sort of to augment and improve our own hyper-local expertise, is usually where we're mired as data folks, right? So next slide, please. That's actually, okay. I've got two examples, broad examples. One is day-to-day tasks. Another one is one of those nationwide examples, and I want to weave in talking about the technical documentation. I need to associate myself with all of Megan's comments. I could do 10 minutes on just the documentation alone. I think it's fabulous. But our amazing Chief of Informatics, Dr. Aga, and she's now the co-chief of EAI, contracted back in 2022 with Burfus and basically doubled our sample size going forward. I am still working on that 2022 sample. And for those of you who aren't familiar, it's chronic disease and social determinants. And 2022 data, specifically in the line level data, there are a lot of cancer screening questions, cancer risk factors that don't occur necessarily in other years. And so I'm working with that data right now. So let's go to the next slide so I can show you what I'm talking about. So on the left would be a typical visualization that I would create. This is showing the proportion of adult residents meeting these colorectal cancer screening recommendations. And again, unlike Shiraya, we report out at the county level, right? We are not a city level jurisdiction. However, I don't think this renders those colorectal cancer deaths, those beautifully age-adjusted colorectal cancer city level deaths, like completely not usable to us. We do calculate those out for certain mortality rates, but not necessarily all site-specific cancers. And it's super easy, especially at this time when I was creating this visualization, and the person who's like super in charge of our mortality data is away. I can just like head right over to the platform and grab those deaths, for those areas. So can you, next slide, please. Sorry. This is just going to show you would click on compare cities. Next slide. And that's the county level data we're usually working with. And then next slide, please. I do want to point out, like, this is where we would find the technical documentation on the website. It's, right under that FAQ section. It's 40 pages. Please don't be overwhelmed by that. It's so fabulous. Next slide, please. So as I mentioned, we do prioritize those metrics that report at the county level, because that's our, that's our sort of bread and butter, and that's what we would put on our website. But I did want to note that when they use county proxies, they are using Bexar County and also the other counties that I had on that visualization. So next slide, please. That's going to show you an example of where you can find a county level metric, right? So COVID-19 vaccinations, adults all years. I have San Antonio there, right? But it's right there in the footnotes and underneath. It's going to tell you each time. And I have another example later on. Next slide, please. So here's another visualization with that BRFIS data I was talking about, a lot of lung cancer risk factors, screening variables. So I wouldn't be using the platform for BRFIS, right? Because I've got the statewide line level data. I'm not going to be doing that. But it really enhances the knowledge, and having those disaggregated out beautifully, rates right down at the bottom. And, if the division head who wants these visualizations really needs to know, we can calculate that out, right? But it's nice to be able to just grab it, say where it's from, and show that. Next slide, please. Oh, sorry. This is just how you would do that, right? So this is just exploring a big city, lung cancer deaths by sex. And again, 2022, I'm using the same year, even though it's not the same data, right? And there's that rate that showed up on that slide. Next slide, please. So since 2022, I have been a member of a virtual monthly meeting through NACCHO. It's pretty small still, but it includes a few member cities or adjacent member cities. They're not, some of them are not exact. But a few months back, we had an absolutely fabulous presentation by an informaticist who is Baltimore adjacent. And one of the things that he was showing us in this amazing presentation were essentially the amount of the Narcan distribution. I think it was month by month, as well as fentanyl strip distribution. And so thinking about this, I'm not an expert in substance use or opioid deaths, any of those things. And again, like coming into a group where you have like multiple far-reaching or far afield public health professionals, it's good to have the perspective of the other groups. And it's super easy to do that, right, with that Compare Cities tool. So next slide, please. We would use that center button, next one. And there are the localities. Again, these are not exact. And I've got Baltimore there because that's the closest member city to the presenter. And next slide, please. I did want to mention, like, over on the left, that's a little bit overwhelming potentially for some folks with all the years. But if you look just in the center at that 2023 data, it's super easy to see why even someplace that's maybe 14 miles outside of Baltimore would be closely tracking this kind of public health data, right? And then over on the right, I've got it disaggregated out by sex, just for interest. And we could also do that by race, of course. I just want to close. Next slide, please. Another poll for that 5-city comparison selection. I want to talk about, sorry, next slide. Their comparison cities tool, which is amazing. I have covered over all the scary statistical jargon because I know it's not everybody's cup of tea, but I did want to reiterate, like Megan was saying, the big cities team is so responsive to membership. You can see, like, most of us are going to compare our localities to other cities or counties in our state, right? And you can see underneath that modifications because of requests made by member cities. They have forced in at least one regionally close city to your 5 cities comparison. So, and I have an example on the next slide. That's what would show up at the bottom there for San Antonio. So if you put in San Antonio, the 5 cities that show up for your comparison are Austin, El Paso, Los Angeles, Phoenix, and Tucson. And then next slide, please. This is just another example of some of that available county level metric data, right? On the left, we have hazardous air quality 2023 and flu vaccinations from Medicare on the right. That's all. Thank you so much. You guys are amazing. We're so grateful to have you helping us out here as data folks. Thank you.
Thank you so much, Katherine. Thank you for sharing all your expertise and your willingness to try a whole lot of things on the platform. Our next discussant or speaker is Susan Long-Marin. And so actually, Susan, you can answer. We have one of the questions that maybe will be part of your answer. How has the BCHC or the website evolved over the years? So Susan has been with and helping assist with the platform or with the data before there was a platform. So thank you for bringing historical perspectives into this, and also thinking about, I think Charlotte or Mecklenburg has maybe been not used the platform all that much, but are thinking about ways to use it, which may align with some of our audience members and what they're thinking of too. So we'll let Susan take it away.
Hi, everybody. I'm Susan Long-Marin, and I manage the epidemiology program here for Mecklenburg County Public Health, which is in the city of Charlotte. We are a combined city-county health department. And as Amy said, I guess I am the historian in the group. I can't even remember back when we started working with big cities, but I can tell you it was when they sent us paper forms in the mail to collect information on HIV, STIs, some mortality, and some birth-related statistics. And we would fill them out and send them back. And then we would get back in the mail once a year a paper-bound book that had tables for all of that information. And even then, we were trying to look for, we were always interested in peer cities, we wanted to know how we compared to other cities. So then we moved into later where they started collecting a lot more information. And so by this time we were getting electronic files, and there was some catch up to do. And so we had to provide years and years and years, no joke, like 5 years of mortality information, birth information, STI information. It took us forever to do it. It's like, we want to help, but this is really onerous. So we were absolutely thrilled when Drexel took over and said, we're going to collect the data ourselves and y'all don't have to do it. Because again, we're glad to help and we love having the data, but it just made life so much easier. Again, because we are a county city department, we don't use the data in the sense of reporting it out because we have our own vital statistics and our own birth sample and that kind of thing. However, there are tons and tons of metrics in this website that we love that we don't have. Things like walkability, bikeability, different air quality measures, just things that we can go to and check those out and use those when we don't have, an easy county comparison. To echo Katherine and Megan, our absolute favorite feature is the 5-city comparison. And we pull that up a lot just to get trends and see what's going on. And like Megan said, it's a quick comparison so we can look at different groups and say, oh, that looks different. Let's see how we look with other groups and maybe zero in on something. Then we will turn around and pull our own county data to go with it. But we love the 5-city comparison. The data is used a lot by people if they're in a hurry and, somebody calls up and they want to know, how do we compare with wherever, Boston or Columbus or and it's a quick way to do that kind of thing. If we don't have to have an exact number that we publish, we can just say, this is what the trend looks like. This is we're a lot better, we're a lot worse, that kind of thing, or we're about the same. We know that the Robert Wood Johnson County rankings is going away, and that's what we were using for our pure county rankings. So now I think we will be using big cities and the 5 comparison cities to fill that role. So again, the comparisons, there's also some of the things you can sort out some of the cities, like your 5 comparison cities, and then look at them by the amount of segregation in the city or the amount of poverty in the cities, and do your comparisons that way, and just features that are wonderful for lack of other words. So there's so much potential on here. And again, we're working on trying to figure out how we can better utilize it with our county level data. I think, as Katherine said, there are several variables that actually are county level data, and that is great. After talking to Amy recently, we are seriously thinking about putting a link on our website to the source with just a strong message on it saying this may not match up with some of the data that we publish because it's city data. It's the city of Charlotte. But as pointed out, we're over 77% of the county is the city of Charlotte. And a lot of people who are writing grants and that kind of thing actually would benefit from having city data. So making it readily available, I think, can be really helpful. Or again, we're close enough, especially now since we've had so much gentrification in the city, that some of the measures are starting to look a little bit more like the outer suburbs. So the comparison is also not quite as different as it used to be. So I think that's probably what I have to say. Oh, also put in a plug for the documentation. We love documentation, and the fact that the data is usually as new as the data is out there. Most of these big platforms that you look at, the data is 2 or 3 years old. And so we appreciate it for that reason. So yes, thank you, big cities. Thank you for this wonderful interactive dashboard. Our county's not into having us put interactive dashboards in place, but we can put a link. That's a whole different story. So I think we're moving in that direction. So thank y'all.
Great, thank you. Thanks so much, Susan. Thanks for hanging in there and being a resource for us. So Susan and also Russ Jones, who is at Fort Worth. Both of them were asked for the Compare Cities feature, and that's how it all came about. So thank you for your investment in the platform and giving us ideas and feedback. And then we cycled back actually during some pre-testing phase. I don't know, Sue, if you remember, but we asked you how things were working with the feature and all of that. So which addresses a little bit of one of the questions that we have that have come in. So please ask away. We only have a few questions, but we will field them and get started. But please ask. Let me just put up the this is our speakers. Again, feel free to ask a question specifically of a speaker or just more generally. So one of the things was, how is the BCHI evolved? So Susan spoke to that a bit, and
Amy, there's somebody with their hand raised too, if you'd like to.
Great.
Yeah, I see your hand raised, and I don't know if you would like to ask a question. I'm going to allowed you to.
Anandi, we can take you, allow you to use the mic.
Go ahead. I can see that you've unmuted, but I can't hear you.
Yeah,
Sorry.
feel free to type your question into the chat. We might not be able to hear your audio for some reason. Yeah, there's some questions about APIs. Yes, we can provide some access to APIs. We haven't made that functionality general yet on the platform. So if there is a large request for the access to the APIs, please forward that to us so we have a sense of how many people actually want to use that. As different from some needs for API, the website is not updated all that frequently. So it's not like you would have to keep churning or keep running requests to the API. But yes, it is another way to get the data rather than just downloading it from the CSV, the CSV file. We have a question from Morgan Poole about adding a city. How does a city join? Elizabeth, maybe you would field that one.
Yeah, sure. So Big Cities Health Coalition is 35 members, and the parameters for membership are that it's a city that is at least 500,000 in population and has an I'm not going to get the terminology exactly correct, but it basically is an independent health department, not an office of the state health department. So yeah, so it limits the number of cities that can actually be members of the organization, but those are basically the criteria for membership.
So we did Nashville recently joined, and sure if we had there were a few folks that joined a couple of years ago as well. Let's see, one other question around R code, statistical code. Yeah, forward your questions. I don't know exactly what R code or stat code you're looking for, but feel free to forward your questions. There is, we do want to put a plug in for the survey. There is, or just a place to answer questions or get questions answered on the FAQ. Let me share this. So in the FAQ tab, one of the last questions, who should I contact? Please submit them here. You can go to this, it's just a 2 or 3 question questionnaire that this gets fielded directly to us by email. So if you have questions, you can just put your question here and we'll get this immediately. So it's a good way to ask your questions. Otherwise, this is our another email where you can ask your questions. Let's see, any other, Tina Lopez, part of the San Antonio group, I think. Thank you for joining. I don't know if you wanted to share anything on your end about using the platform. You had some questions about city versus county. So unless otherwise specified, the data are city level. There are some data that are like ambient air pollution data that maybe you would, could be obviously considered for a larger region than just city. We have city was our first priority according to BCHC's mandate for our work. The city data were the priority in order for cities to be able to compare to each other, compared to other urban areas. Most of the jurisdictions, even for health departments where it's a county health department, for many of you all, the majority of the population in the county are living in the city, in the index city that is on our platform, like Indianapolis, Charlotte, San Antonio, many of the cities, Dallas, I think even, is 80% or more of the county population is actually coming from the city. So in that sense, it's a fairly good proxy for county, although the numbers may not match exactly, but you could use it as an approximation, particularly for internal use, like Susan is saying that they use the data for. Tina, was there something else you had on
Maybe
the
there are also a couple of other questions in the Q&A box.
jurisdiction? Okay. How was the 5-city comparison developed? Yeah, that is in the technical documentation. Let me open, I'll show you where that is. This was really a starting point. Ariana Alonso, I'm not sure where you are, but this is a starting point. So for example, Philadelphia, 5 comparison cities. We changed this actually a little bit based on what feedback we got from Megan. So this is whatever we have in here is really a starting point. We want your feedback, particularly those of you who work in the, oh, sorry, I wasn't sharing my screen. We want your feedback on which cities should be in the compare cities. There is a restriction though, so it's only going to be cities that are in the big cities health coalition membership. So not any city, but if there are particular cities that you think are better comparisons than the one we provided as a starting point, please just let us know. We are happy to get feedback on this, and we can easily change this list. So this was largely, we can look, I can show you here on the FAQ, the details on the metrics, the 5 comparison cities. There's some example, this may be a little more technical, but basically it was from some population, poverty, Hispanic, non-Hispanic, Black, region characteristics, and then overall all-cause mortality was part of the clustering algorithm that we used. And then we did make some adjustments and restrictions based on region, because Russ and others had told us that they are often using regional cities as their comparisons. So yeah, please, we have not received a lot of feedback on the comparison list. So we're anxious to hear from all of you whether the comparisons that we are picking make sense. So the reason that
noting that you can set up any comparison.
Yeah, you can just change this here. You can, yeah, it's all dynamic. You can just set your own comparisons. This just makes it easy. So the main reason, one of the main reasons to have comparison cities is because cities wanted to have some index for themselves, but also it allows us to, it allows users to look at trends. So when we look at all cities, we lose the ability to look at trends because there's so many lines. So we disabled the trend plots for when there are more than 7 or in total more than 7 cities that are being displayed. Do keep in mind, often folks are interested, and it's not all that apparent that you can compare your city to the US total very easily. If you select US total in the cities for comparison.
And did you see that there's a question about R code and statistical?
Yeah, I answered that in a general way. Reach out to us if you are looking for some code that we might be able to help with, and we can determine whether we have it or not. Megan, Katherine, Shiraya, Susan, any questions for each other?
I think we're
good. Oh, we're at time. We should be careful to stop the polling, otherwise we will lose it.
I did.
I'll let you do that. Okay. Thank you so much, everyone. I think BCHC there'll be a link to the recording. Does that get sent out? Okay, with the slides. Thank you all for joining. Please send us your questions, send us your requests. Let us know how you are using the platform and what we can help with. Thanks so much for joining today. We really appreciate your time and expertise and your public health work. We value you. Thank you.